Very good afternoon, everyone, and thank you for joining for this COVID-19 update and media briefing. We do apologize for the late start, as we would appreciate a number of meetings are going on behind the scenes. We will be addressed by Prime Minister the Honorable Mia Amor Motley, the Minister of Health and Wellness, Lieutenant Colonel the Honorable Jeffrey Bostic, the Manager of Isolation Facilities, Dr. Corey Ford, and President of the Barbados Association of Medical Practitioners, Dr. Linda Williams. Now, the Acting Attorney General, the Honorable Wilfred Abrams, the Chief Medical Officer, Dr. Kenneth George, and the President of the Barbados Nurses Association, Ms. Valerie Francis Miller, are also available for questions. We will begin with Minister Bostic.
Thank you very much, Lisa. Good afternoon to each and every one of you. The first thing I want to do basically is to give you the stats for today in relation to cases. The Best Dos Santos lab would have conducted 1,668 tests overnight, and those tests yielded 282 new positive cases, 282. 273 of those persons carrying Barbados ID cards, and there were 49 persons under the age of 18. So as you can see, the number of positive cases continue to fluctuate at this point in time between the 200s, and we had one instance, I believe, for the week where we went above 400. So generally speaking, we've been averaging about 300 cases daily and about 2,000 cases on a weekly basis. So this is the situation that we find ourselves in at this point in time. We've continued to do as much as we can in terms of managing this situation, including changing things that require changing because of the nature of the Delta outbreak, and also increasing capacity in areas where we needed to increase capacity. So that, for example, we would have been able to open a new testing facility at Queen's Park Steel Shed, and that is going quite well. We're able at that facility to be able to swab about 7 persons at a time, and we have seating for 48 persons inside of the facility and another 60 persons in tents outside of the facility. And the rationale for locating the testing site there really is to take some of the pressure off of the gymnasium testing site, which has already been reorganized so that things are going much better there, and also to take some of the pressure off of the Brantford Tate Polyclinic and the Eunice Gibson Polyclinic. So in relation to the impact on the healthcare system as a result of the cases that we've been having, and remember, I would have indicated before that we are definitely focusing on trying to save lives and trying to get those persons who are ill out of their homes so that they can be treated, so that they can be dealt with. And we've introduced a number of initiatives in that regard, including a community program, which is similar to the Seek and Save that was conducted earlier this year, but on a grander scale. And we've also been able to do a few other things, like establishing the respiratory clinic at the Queen Elizabeth Hospital. And some days we're seeing some very large numbers of persons at that clinic, but we had a period of about 3 or 4 days where we were able to get everyone out of the tents and into some sort of facility. But that has been, like the figures, the total number of positive cases, that also has been fluctuating. We've been able to bring a number of other things on board. Harrison Point facility, that is now fully functional again because we were making some adjustments to what used to be the quarantine facility to be able to use that for primary and secondary isolation. And only today we would have received some equipment at the airport, and on behalf of the government of Barbados, I would like to thank the United States Embassy and the officials who are responsible for assisting us with airlifting the 2 oxygen plants that we had ordered some months ago to be able to give us some much needed capacity as we expand our facilities here in Barbados. We also got a donation of about $3 million in pharmaceuticals and PPE and other items, and of course, they are very, very welcome at this point in time. So that this is the direction that we are going in. I know Dr. Ford will give you a bit more information in relation to what is happening at the clinical level and within his facilities, and I will come back a little later to address another very important issue, which I'm sure you would be happy for me to report on. Over to you, Dr. Ford.
Good evening to all Barbadians. Again, I'm thankful for the opportunity to speak to you, to give you a real broader prospect of what's going on across the facilities. As I always do, I like to first start off by thanking all the members of staff who continue to work assiduously across all the facilities with an aim to save as many lives as we possibly can in this pandemic. I do recognize, however, that these are difficult times. I've said this several times before, but I will greet you this evening by giving you some short wins that we have achieved in this battle. And that's number 1. You recognize from the minister's previous conversation that we were able now to reopen a part of the isolation facility, which was once called tertiary isolation. You might well remember that. This is a place where we will have people who are relatively well. But we've now moved on to have an oxygen supply level in that area. We've opened the facility. It's in use at the facility, and I'll give you an idea of how many people are actually there. We're able to provide oxygen and all the different amenities. We further now expand our capacity in terms of our ability to provide a higher level of care within that particular area. And I think that that certainly is a major feat for the country. Additionally, I would like to report certainly to all Barbadians, one thing that I think is important, and this one has a special place in my heart, and for all those who will laugh at me every time I tell you that I grew up with my grandparents, so I'm a grandmother's boy, our grandfather's boy, is really the reality of things where I'm concerned. And we were able to swiftly and skillfully manage as many patients as we possibly could in the geriatric hospital, and now we're out of that particular zone. And I think that's testimony really for all of you listening today to the importance of vaccinations, given that the majority of almost all of those patients were vaccinated. I say that and I move on to tell you, look, what else have we ever achieved over the last few weeks since we spoke? And the next one is really, we actually went into 2 nursing homes. Again, the picture is the same. Elderly people, like my grandparents, fortunately, 2 of them are not here, but we went into those nursing homes and we were able to save those elderly people in that nursing home, at both of those nursing homes. And I think that that certainly is a major feat. If you remember very early on in the early parts of this outbreak, that many elderly people died in nursing homes across the globe. And I think that that's a major feat, certainly for the Ministry of Health. Additionally, we continue to work together with our partners to try to improve the level of care across our system. And I'm very pleased to announce to you that we continue to have discussions, certainly with BAMP, and I'm sure they'll speak about that later. And they will come in and continue to help us, as they have been in the past in many different ventures, in an attempt to try to help us in terms of, giving some relief to some of our healthcare workers who are on the ground. I'm very thankful to them for the discussions which are going on. Very, very, very thankful for that. So I think I just really want to mention those very important things to you, but also mention as well, and I think this needs to be said, that many of our young persons who are on the ground, and I've said before that sometimes young people in the country sometimes get castigated for some of the things that they do, but many very young people from many walks of life in Barbados have stepped forward to assist. And one of the things I need to bring to the floor this evening, and to thank them as they listen on today, is many of them have come in and have been able to achieve things that they didn't have, the capacity to do before. So we have people now in training in various areas across the facility, which will lend to assistance to the nurses and to the physicians. And there are some other things this week that we're hoping to introduce to try to improve that more. You would recall that we had our colleagues come in again from part of the Bajan diaspora, and nursing have come in to help at the facilities. They were very well welcome. I think they meshed in pretty well, and they continue to mesh in pretty well, and we are really thankful for that as well. So I think despite that we're in the midst of a storm, I think there are some wins that we have certainly achieved, and I think it's important for you out there to understand. But even within that, we continue to fight this battle. And I'll give you a great picture of what's going on within our facilities. We do have some very, very ill individuals within our facilities. So if we think in our primary isolation A area, which you knew before as primary isolation, we have a total of we have a total of 30 people within that area. 20 of them are on non-invasive ventilation. That means they don't have a tube down their mouth. And then 4 of them actually are on invasive ventilation. In terms of the primary B, which is the adjoining section, this is a new section which used to be called secondary isolation. We have a total persons there on oxygen as 10. In our new secondary / primary isolation or high dependency unit, we have a total of 73 individuals. The majority of them in that area are on oxygen, and the majority of them have severe disease. So if you look at the numbers, basically we're saying from our perspective, we have a total of 25 persons who are severely ill and 5 persons who are critically ill across the facility, across the facilities across the country. And this, I think, is very important. But I just wanted to take the opportunity to tell you something which I think is important. I started off by saying it before, and that I think as you listen on this evening, I just really want to encourage for those younger persons at home, and for those persons at home whose elderly parents are still alive, I really want to encourage you on something that I think is important. Over the last few months, and I really took pains to go to really look at this information. I have a special place in my heart for the elderly population. Don't ask me why, I keep saying why before. But in August, we had a total of 1 person coming into the facilities who was 80 years of age. In September, there were 23. In October, there were 42. So far for November, we have 18. And those numbers may not seem big to you, but to me, they're significant. And why are they significant? Because these are the people who are least likely to be able to help themselves. It is the average Barbadian who, or a younger person in the house who go out, they may go to the supermarket, they may go to the gas station, they may go with their friends, they're not supposed to be doing certain things, and they go do them and they bring them back home for old granny or old grandpa at home. And it has an impact on their life. And although we have saved the far majority of these individuals, it is painful. And it is hurtful to see elderly people in that situation. And we will continue to do all we possibly can to assist them. But you need to help me. You need to help all the doctors who are working across the system. You need to help all the nurses, all the housekeepers, all the individuals who are working across the system in making wrong things right. I'm asking you especially today, for all of you who have your grandparents at home, for all of you who have your mothers and your fathers at home who are elderly, who can't help themselves, they don't go anywhere. I'm asking you specially to do 2 things for me. Just 2 things, just 2 things. 1, if they get ill, get them tested. If they get tested, get them to the healthcare system early. If you get them to us early, we can make the best of it. If you get them to us late, it is very, 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 very difficult for us to save them. That's just a stark reality. And this is no different as has happened across the globe. So get them tested and get them to us. And play smart. Play smart. Get them vaccinated if they're not vaccinated. That's my update for you today, and I'm going to land on that end to you. Play smart. Get those elderly people vaccinated. If they're ill, get them to the healthcare system as early as possible, and I assure you that we will do all that we possibly can to ensure that our elderly population can be safe in the presence of COVID. This has been a challenge globally. It's not a Barbados challenge, but I believe certainly as citizens and residents of the country that we can do much better to help that population. Thank you.
Thank you very much, Dr. Ford. And we go back to Minister Bostic at this time.
Thank you very much. One of the things that I had decided today not to do really was to go into too many statistics and figures, because I wanted us to focus on some other things. But I think that I will share a few more details with you before going to the next real point that I wanted to address. The numbers have been high in terms of positive cases, but I can report to you that we began to see some improvement in the situation, which I didn't and I don't want to address fully, but suffice it to say that the positivity rate has dropped now to about 15.9%. 15.9%. And as you know, it was much higher than that before. I also want to say to you that although the number of deaths that has increased, our case fatality rate at the moment is about 1.35%. And to put that in perspective, the global rate, case fatality rate, is between 0.9% and 7.6%. So we are at 1.35%. And I really didn't want to go into a lot of details for one reason and one reason alone. I did not and I do not want for Barbadians to become complacent, because we are nowhere out of the woods, because the figures are still too high. However, all of the thresholds that we have established in the past, those are trending downwards at the moment, but we still have a very, very long way to go. But I want to come to the issue of the safe zones, because this is a very important matter. And it is very important, I would say, from two perspectives. First of all, obviously this created some anxieties among some of our stakeholders and the general public. And I'll be the first to say with some justification, because there were one or two things from the legal perspective that I myself was not too clear about until the persons who drafted the legislation actually, along with the acting attorney general, went through the legislation piece by piece, and then I myself got a much better understanding. And so I think it's important for us to be able to say something about this. But the other important reason for me as Minister of Health and Wellness is simply this. Within the public health care institutions or hospitals, that is Queen Elizabeth Hospital, the geriatric hospital, psychiatric hospital, and our district hospitals, within the last 4 to 6 weeks or so, we would have seen approximately 350 positive cases. 350 positive cases, with the majority of these cases coming from the psychiatric hospital. And the reason why I'm raising this, because this is what the safe zone policy for the healthcare sector is all about. In spite of the high number of cases that we have been experiencing over the last several weeks, the two things that will cause this country significant problems: one, if our healthcare facilities are overwhelmed, and by healthcare I mean all, in both public and private. If you were in a situation, for example, where in our efforts to fight COVID, we could not do a lot of the other things or provide a lot of the other healthcare services to the general public, that then will be a significant problem. And secondly, our already stretched human resources, this for us is something that we have to be very, very, very careful with. And why? Because if we get outbreaks in institutions that involve large numbers of staff, then we are going to be in significant problems. And so in terms of the safe zones policy, And let's say for public health care institutions, what we are seeking to do is to try to ensure that we provide a safe place for those people who have to work with each other, as well as a safe place for patients and clients within those institutions. And it really has, that's a national imperative from our perspective of fighting the COVID and the Delta variant at this time, the impact. But we recognize that obviously there were issues, and I remember I had a meeting, first of all, with BAMP, Barbados Association of Medical Practitioners. And as a result of that meeting, I was going to have some other meetings with other stakeholders. But what I decided to do was to take to Cabinet on Thursday some of the issues that I would have picked up, and also in speaking to some of the other stakeholders, and to seek some direction and some guidance from the Cabinet, the Prime Minister and Cabinet. And that direction came around 1 o'clock or so on Thursday, and we tried then to convene a stakeholder meeting so that we would have all of the major players at the table, and we would go through the legislation line by line so that we could hear from everyone. Some persons we invited were not able to make it, and the others who had indicated that they would be present that did not turn up eventually, and so we were able to hold it with who we had there. So that this is a work in progress, and we have made some significant progress in this regard, definitely. But we still have to have the stakeholder consultations with the other entities, and these are primarily the trade union movement, C2SAP, and those unions that have members within the healthcare sector. And that will happen over the next few days until we are able to get something that has the buy-in of the stakeholders. But I want to report that we have made significant progress. Some of the things that were raised, and I would have consulted with the Barbados Nursing Association, the president of the association, when we had the first draft. Some things were put forward there. BAMP had already expressed its concerns and submitted a letter, so we tried to address those. And the next step would be to discuss matters with the trade union movement so that at the end of the day, we are all on the same page. Some of the issues that arose from the meetings, for example, we recognize very clearly that when it comes to providing testing facilities and tests for the various sectors, that we cannot and will not stick to just the PCR test as we know it, because especially at this time with the Delta variant, we can use some other tests like the antigen rapid test and some other tests which we will announce once we've completed this exercise. That will make that process a lot easier because the test will not be as invasive as the PCR tests. So those are the things that I wanted to report in relation to where we are with the safe zone in policy and directive, and we will provide some additional information at a later date. Over to you, Lisa. Thank you.
Thank you very much, Minister. And we now go to the President of BAMP, Dr. Williams.
Good afternoon, Barbados. The Barbados Association of Medical Practitioners made a call earlier this week for the draft on safe zones to be looked at again. Our primary interest is the public's health and the health and safety of the medical fraternity. We are thankful to be able to express our concerns and make our recommendations to government. We believe that for public health measures to work, people must accept them and understand them, whether it is the general public, employees, unions, everyone. And so we are grateful for the continuing consultative process with all parties. We were concerned, as was the public, that the concept of a medical safe zone was not fully understood with respect to health care. But as Minister Bostic has just said, no patient should ever be disadvantaged in the access to health care. And we are now satisfied that this legislation was not intended to and does not bar any patient from attending health care, and that vaccinated or unvaccinated health care will be available to all. Vaccination and testing are our way out of this pandemic. Vaccination is a major tool, along with the other non-pharmaceutical interventions such as hand sanitization, social distancing, and also the wearing of face masks and cough etiquette. But we must not neglect all the other tools: caring for your body, taking your medication, not smoking, limiting alcohol, getting sunlight, diet, exercise. All are very important parts of the toolkit needed to fight this invisible enemy called COVID-19. We were also concerned that with the wide variety of healthcare providers that the public seek healthcare from, that these persons who are more regularly exposed to COVID-19 would be a risk to the public with the highly transmissible Delta variant, and that persons who are coming for health care should never be exposed to an increased risk from their healthcare providers. And that's why the concept of a safe zone came into play. Now, vaccinated and unvaccinated people, we know, can transmit the COVID-19 virus, but the unvaccinated can do so for a much longer period and more efficiently. Therefore, we believe that there must be surveillance at healthcare facilities, which means that we look for people who are infected even before they become sick. Because in the early infectious period, you can have few or no symptoms. And that's the concept of surveillance. We are glad to hear that the tests which will be used in the future will be less invasive forms of testing, such as a nasal self-swab, which is supervised. So it's a self-administered swab, and this will be used as a rapid test, a lateral flow test. And in many countries overseas, this is done every day for some people going into healthcare institutions and other major institutions. But we believe that some measure of knowing your status is really important in this fight. And we will continue to sensitize our constituents and the public about why knowing your status is so very important. My last point is to do with the Harrison's Point and the other isolation facilities. I went there, met with Dr. Ford, and saw the facility along with a few members of my council. I was really impressed by the first-class nature of the facility and its capacity. But human resources are needed. The persons who are working there, they've been working tirelessly for a long time. And as we walked around, I remembered the early days of HIV, when we had a great deal of stigma attached to the disease. COVID-19 is with us and is going to be with us for some time. We should not stigmatize anyone for having COVID-19. We as doctors have to learn to manage it, and the public also needs to realize that at any time, any of us can be affected. No matter how strong you feel, any of us can be affected, not just in the short term, but also in the long term with the effects of long COVID, which are even now being explored. So know your status, Barbados, and if you've been exposed, please go and get tested. If you just want to know, get tested. If you start to feel ill, even if it's slight, get tested. And for those who get tested, please seek care. And the home isolation is there for you. Also, if you are become more ill, I'm telling you that Harrison's Point is an excellent facility and can look after those who are ill. So my final words right now or today is that BAMP is here to help. We have been helping all along. We have been making recommendations. Our doctors have worked in every area and every aspect. And I just want to encourage more and more doctors to get involved on the front line and to assist us in this battle. Thank you.
Thank you very much, Dr. Williams. The Prime Minister will now address the country.
Thank you very much, Lisa. Distinguished Barbadians all, it is today for me continued recognition of the importance of how we carry a baton. And forgive me if I start this way, because my mind is both with you here and with our negotiating team in Glasgow as they currently report that we think we've reached a deal globally. It is not the perfect deal by any stretch of the imagination, but is one that allows us to be able to see progress from where we were a couple weeks ago. And we'll have more to say on that in the future. But with respect to where we are with the management of the pandemic, Minister Bostic has spoken and updated us as to where and how things have been, as well as Dr. Ford. And I would only want to reinforce their messages and to recognize that that message has been constant throughout. The reality is it is too early for us to be able to think that we are out of the zone, as Jeffrey said, but by the same token, we know that we are doing better, and we know that this is a marathon. And as Dr. Williams said just now, we have COVID with us for some time. Against that backdrop, I want to re-echo, or restate rather, and echo the comments made by Dr. Ford with respect to those persons who still have elderly persons in their households. Let us make sure we vaccinate all of them, and those who need the boosters, the government has made arrangements for boosters to be given, so there is no issue with respect to access. By the same token, we repeat the call that persons ought to be able to come forward, especially as soon as they start to feel any kind of symptoms whatsoever, and certainly where the loss of taste and smell and all of the other things, please come forward. Dr. Williams is absolutely correct as well that and I want to thank BAMP for agreeing to work yet again with the Ministry of Health officials, in this instance the QEH officials and Dr. Ford, in helping to see how we can give those who have been there working non-stop for the last 21 months the opportunity for some respite along the way, because this, as we know, is a never-ending process for many of the people on the front line medically. At the same time, we continue to recognize the critical importance of surveillance, not just with the safety directives that I'll come to shortly, but generally on behalf of all Barbadians wanting to know what their status is, and giving themselves the assurance that they're good. And let me share my own experience. As you know, over the course of the last 6 weeks, I've had to undertake business on behalf of the country. And in every instance, I've had to undergo to daily testing in any event that was a multilateral event, any event that required high-level meetings. I had to test daily. In some instances, people tested me. In some instances, it was self-testing in the way in which Dr. Williams referred to, with the nasal self-test. And it just depended on whether you were in the United States of America, or in Glasgow, or in Brussels. So that we're very clear that the world is reaching a position where it recognizes, and believe you me, the test that I had at the end of March last year, when I had to do my surgical procedures, was much, 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 much worse than the tests that I have been doing in recent times. And it's largely because the testing, they're now using microtips for the most part, and it is not as invasive or as does not hurt anywhere near as much as it did before. So I want us to appreciate that when we go to test, the one person we're helping is who? Ourselves. And if we use that as a mantra, the old saying that Barbadians had, one blow is kill old cow, we will make sure that we keep each of us out of it by ensuring that we do the regular surveillance that makes the difference. Of course, we continue to boost the calls for vaccinations, not just for those persons over 70 or over 80, as Dr. Ford has asked for, but for all of us. But the good news is that Barbadians, as I've said, have generally been responsive, and when we look at it, 66.3%, or just on 2 out of every 3 people who are over the age of 12 years old, have taken the vaccine in this country. And I really do want to salute Barbadians for putting us in that position, because 152,000 people is not 152. And it is by far the majority of the population, but it is still along the route to where we want to go. And we will continue to encourage persons at the community level. We've done and improved our community engagement considerably, Minister, and I believe that we can continue to even go further, both with respect to community vaccination and community testing. Minister of Bostic, it will go. I believe Jeffrey will take a few days leave, which is much deserved, like some of the doctors who have taken leave. But the bottom line is that we will have Minister Walcott act as Minister of Health from tomorrow, and we will continue therefore seamlessly. CMO, welcome back. You had your leave and Dr. Best acted while you were away, so that Barbadians will recognize that this is a group effort and a team effort. And I want to thank everybody, including BAMP and Valerie from the Barbados Nurses Association, is also here. As the Minister Bostic said, we are in the process of continuing the consultations with respect to the safety directives. Indeed, the Acting Attorney General, Wilfred Abrams, is with us as well. And to that extent, therefore, we are happy that we are close to the point of being able to sign off on this safety directive for our health professionals. The Minister indicated very clearly why we're doing it, and it is to protect persons. There was never an intention for patients to be subject to it, and I think that Dr. Williams and others have explained the disparity with respect that occurred, largely one with respect to understanding the drafting, but secondly in making sure that as we go forward now, that we are using as simple language as possible so that that public education that is so critical can take place. We believe as well that we can move seamlessly into consultations with respect to the protective sectors, as well as with respect to the tourism and hospitality workers, so that the majority of those frontline workers can roll seamlessly as we complete the discussions in the next day or two with the health professionals and allow their directive to come, so that we can soon thereafter have the others. We know that we are targeting the 1st of December for the commencement of them all, and to that extent, therefore, you will appreciate that every day counts now in our discussions together in order to be able to have the kind of safety zone that we need. I also want to say to the United States government, thank you very much for the donations which we received this morning yet again. Last week we got the second tranche of vaccines. At the same time, this morning, as the Minister indicated, we received 2 oxygen plants that we had ordered about 2 months ago, and they assisted in helping us airlift those plants in. Those are the ones that will go to the tertiary facility that is being converted into primary on the bottom floor and secondary on the top floor, and that will carry us to well over 150 beds at Harrison's Point that will have direct access to oxygen. And I'm told by the officials that having received the plants today, that within 7 days or less, those plants should be operational in the bottom floor of that tertiary building. And that poor building has gone from quarantine to tertiary to primary, secondary. So it just shows you the dynamism of the pandemic over the course of the last 21 months or so. We want to thank them as well for the donation of $3 million in therapeutics and also PPE. This has been a drain on our country, but we continue to do what we have to do. And that is why we manage things in a dynamic way. This is not an occasion where you can have a set of figures put in one place and ignore them for months, because the reality is that circumstances unfold and you have to be able to respond to them. Whether it was the opening up of isolation facilities in our schools, whether it has been in the conversion of secondary to primary and now tertiary into primary and secondary, this is a dynamic event and we have to be able to respond. I'm grateful that our partners, both with respect to those with whom we do business locally as well as with the IMF and others, understand and appreciate the dynamic nature, and therefore the government will continue to account to the people but respond in a way that allows us to save lives and to save livelihoods. Against the backdrop of all that's taken place and against the backdrop of the consultations that I promised you that I would have across the board, both on the ground and sectorally, it is clear that Barbadians have been managing the process of the increased surge as well as we can expect for the most part. The bottom line is that Barbadians have also recognized that this is a marathon, and therefore you almost see some people playing within the crease, but it is also critical for us to accept, as I've said over and over, that while we are at a stage where we accept the seriousness of the pandemic, we also accept that we're not a one-issue country, and therefore there are other critical issues that have to be addressed if people are to live and to support their families and to continue to keep their businesses afloat. It is against that backdrop that after consultation, we have agreed that we will now shorten the curfew hours, and that as of Monday, the 15th of November, I believe, that the curfew will move from 9 p.m. until midnight. That midnight will remain in place for the next 4 weeks, but we will review at that time to see where we are, recognizing that we are continuing to encourage persons to increase the vaccination rate, recognizing that we're continuing to encourage persons to maintain the protocols. The easing of the curfew is no excuse for people to abandon the protocols and to abandon in particular mask wearing or the other things that are necessary to keep us safe. We also recognize that parallel to what we are doing here, that as I said, we will expand and build and roll out the safety zones such that persons can feel more comfortable in doing what they had to do. I know what it made me feel when I had to test every day, and the comfort that those who were with me were also equally free of any virus because of the knowledge of the test results. I also know what comfort it has given us that those of us who are vaccinated are less likely, not impossible, but less likely to receive a breakthrough and to be part and parcel of those who become symptomatic or positive, whether symptomatic or asymptomatic with the virus. Against that backdrop, therefore, I ask all Barbadians to continue to walk with us in the direction in which you have been walking. I made the point that literally since the middle of August, we have done exceptionally well in being able to increase the vaccination rates. We would like to see it go further. I'm told by the Ministry of Health that they're still awaiting information with respect to the 5 to 11s, and therefore when they feel they're in a position that they have the information that they need for the technical committees that have been established to review these things, then they will let us know. In the interim, we continue to encourage you, therefore, in particular, to take those children under the age of 18 and those persons over the age of 70 to ensure that they receive the greatest possible protection that they can. With respect to the final point, as I said, we do want to be able to expand the mobile testing sites, and I've therefore asked the Ministry of Health that beyond Queen's Park and beyond the polyclinics and beyond the gymnasium, that we also look to see how else we can reach into the nooks and crannies of this nation to give persons that sense of comfort that they can have access to these matters. With that, I think that we're open for questions now, recognizing that hopefully the concession that we are given with respect to curfews is in response to the many requests across the country, and we hope that whether it is in Oistins, where the cries from those vendors were greatest, or whether it was in Baxter's Road, or whether it is in restaurants that Barbadians have been going to, or whether it is for persons who, for whatever reason, playing individual sports may want to play a little later in the evening, or whether it is the fact that businesses in town and in the malls recognize that for Independence and Christmas, people want to do a little something that would make them feel a little better and a little special, especially for their families. And to that extent, therefore, this expanded opening hours and movement of persons will hopefully aid in this respect. I don't need to tell any of us that the gas and brake approach still exists, and that if things get out of hand, we know how to bring it back into hand. And I hope that it doesn't reach there, because as I said, this is in fact a marathon, but I do and have seen clearly where each one does what they're supposed to do with respect to the protocols, and as far as possible, vaccination or testing, then I believe we can find our way safely out of this and safely begin to see Barbados that we want to know and want to be in return. That is our ambition, and I believe it is one that is within our sight to achieve. Are there any questions, Lisa? We'll take and pause at this stage for any questions. Thank you.
Yes, thank you, Prime Minister. I'll just ask my colleagues in the media to identify themselves before posing their questions.
Good afternoon, Prime Minister. Welcome back to Barbados. This is Barry Allen from the Nation newspaper. My question to you is based on, I noticed in the numbers today, our vaccination of eligible people in Barbados has reached just under 60%. I think it was very close to 58 point. How much would this have played a part in the decision to shorten the curfew hours?
To begin with, Barry, thank you very much for your question. 66.3% have already taken the first jab, and that's what matters, because people who have taken the first jab are likely to complete it, and they're going to complete in most instances within 3 weeks. To that extent, we've always said that when we reached a point where we were at 2 out of 3 or 3 out of 4, we would start to take different threshold decisions. We've reached that 2 out of 3. They're probably about, as I said, we'll review in 4 weeks' time, but we want ultimately to be comfortable to reach at least 75% with a first jab and then a second jab. We don't see the complete elimination of curfew until we have 75% with a second jab. But we've started the process of deconstructing now and allowing persons to gradually get back more control over their activities, recognizing that each person playing their part will allow us to keep going in this direction.
Ryan Broom, CBC. I'm not sure who may be best to answer this, but in terms of the goal numbers, the vaccination goal numbers, we've had probably in excess of maybe 8,000 or so cases, home isolation included, with regular isolation in the last couple of months. And as the medical personnel are telling us, it takes about a month after infection before vaccination can be considered. What I'm wondering is if these numbers, these higher numbers we had, are being factored into the goal numbers in terms of what we would want to achieve in terms of the vaccinations.
I think generally, that certainly from my interaction with persons who've had it, and Dr. Ford can speak to it from his, the average person who has had it will say that they want to get the vaccination for the most part, largely because they understand how precarious this condition is. At the same time, Dr. Williams will tell you that we will not take lightly the whole issue of antibodies, because there's no exact science to it, and therefore we won't rely on that in our equation. We have generally said that when we reach a stage where 2 out of every 3 people who are eligible to take it have started the process of taking it, then we are going to be able to work with Bajans to get to the point where we want to do. That has now happened. 66.3% is 2 out of every 3. We know that for the numbers of persons taking the second dose, that almost all who have come forward for the first dose have come back. So we have a very high take-up of second doses in the country. And you can see it from the figures here. 132,034 have already taken the second doses. So that the numbers who have taken and not gotten their second dose is less than 20,000. And bear in mind that may not even be an absolute representation, largely because we also have been giving out Johnson & Johnson as part of the vaccine mix that Bajans have been receiving. So there's no exact science in short run, but we feel that we are at a stage now where, as a family, as a people, that we can take this step together. But equally, as a family and as a people, we remind ourselves, as our parents have many times reminded us when they have given us opportunities to do things that we wanted to do, and that they literally didn't necessarily want us to do on our own, that just watch yourself. And I'm not saying watch yourself because I want to enjoy saying watch yourself, but we're saying watch ourselves because, as the Minister of Health has said, while we're going in the right direction, we cannot give an all clear. And based on what Dr. Williams and Dr. Ford and others have said, we're unlikely to give an all clear with respect to coronavirus, COVID-19 in the near future at all, and that this is likely to become endemic. So that is why, in a sense, we are learning to live with it, but we want to learn to live with it with the least possible consequences to Barbadians. Jeffrey has already told you that our fatality rate ranks among the lowest in the world, but for me that's no comfort, and that's why you don't hear me referring to that, because with every death, and as I tell you I receive them, with every death I kind of do this, and I stop breathing for a second or two because it hurts. But guess what? Regrettably, it is happening in every single country across the world. And that is our reality. Dr. Ford, I don't know if you want to add to what I've said. Thank you.
Thank you, Prime Minister. And the only comments I would like to add is, yes, I spend a lot of my time, despite I'm busy doing clinical stuff, and I think Prime Minister and the others here would know, I spend a lot of time within the actual facilities, talking to many of the young people, talking to many of the middle-aged people, trying to get an idea from having them on the ground, what were their challenges in terms of being vaccinated. And I think sometimes, to be very straightforward, I think it's just a matter of answering some very small, simple questions and trying to allay people's fears about vaccinations. And I think I always say, and I'll say today again, is that I believe it's everybody's choice. But I think if you give them the information, and as I have done in several of these facilities, they'll tell you that. In fact, some of them will say, I'm coming back just for you to give me the vaccine. I said, well, I'm a busy man. I may not be able to do that, but if I have to do that, then surely I will. I'd just like to say that, because I think it's important that sometimes when people have the experience, even of COVID, then they actually see and understand the difficulties. And I think many of them have seen, and I keep telling them, I'd like to bus a few of you and take you down to our primary isolation and see the stark reality of the consequences of COVID. I've always said, in my last statement here, but I've always said that as a country, when we got to a point where everyone knew someone had COVID, then it would be bad. And I also said that when we got to a point where everybody knew somebody who died from COVID, then obviously we'd be in a more precarious situation. I say that we've asked many times for the country to pray, but I think we also at this time need to also be thankful for where we're at as well. Thanks.
Next question.
I have a question for Dr. Ford. I know that he's here. Dr. Ford, are you in a position anecdotally to speak to the level of breakthrough infections and what could be leading to it? Based on the numbers that I have here, is about 1 in every 5 people in isolation that are actually vaccinated. So those will be considered breakthrough infections. But can you say what is leading to the breakthrough infections? Is it people who are vaccinated becoming complacent, or is it more so some of these people would have had comorbidities, and unfortunately the breakthrough infection did occur and they became ill? Can you speak to that?
I think, Barry, just to put things into context for you, because I like the way you asked the question, but I'm just going to bring it way back around. So I think for any vaccine that you take, logically, I'm sure you've had vaccinations as a child, right? And you've had measles, vaccine or mumps vaccine, you can get a fever, right? You can get sore throat, you can get these things. I think the reason why you might see those persons in isolation is not necessarily because they're very ill, for most part. Sometimes what we do, we try to be careful. We know for vaccines, I've said it a million times over, at least 7% of people can get ill. I don't know who those people are going to be. So if anyone, for example, has symptoms of significance and they have multiple comorbidities and they may have cancer or they may have they're immunocompromised in other ways, then it's often the safest thing to do is to watch. And I'll tell you, the majority of those people actually go home. If you look at the numbers that Barbados has had over the last few months, despite that large amount of numbers you just quoted, Barry, the majority of those people are back home with their families, including the old, young, and kids. The majority of them are back home. But the point remains, and it's quite simple, is that for any vaccine that anyone takes, there's obviously still a risk of people still getting ill. But that risk is low. If I compare myself, easy, simple. If I compare this hand of people who are unvaccinated and this hand of people who are vaccinated, these individuals in this hand are more likely to have severe disease. And I'm glad you asked that question because that follows on from the previous question. I spend a lot of time in isolation actually standing and talking to people about this particular fact. So yes, people can be vaccinated. Yes, and they may get mild symptoms, and most of them will get mild symptoms. Some of them can get mild symptoms, but they're not going to end up being hospitalized. And I said it on the international meeting this morning with WHO and Society of Healthcare Epidemiology of America, and I'll restate it here again. And it's simply this, that the majority of persons who are vaccinated across the globe have not overwhelmed the healthcare system with illness. And that is the fact. The world has really failed in terms of its attempt to manage COVID-19. Is one of the failures, right, of the globe, because they were not able, and the minister said it, they were not able to maintain their healthcare system in the absence of a vaccinated population. And if you look back, US is a perfect example. UK is a perfect example. When they first started, look at the deaths, they were astronomical. And that certainly has changed. And what has changed? I don't have to tell you. You see it on CBC, NBC, CNN. What has changed is the vaccinated population has changed. Look at India. Remember when India had a problem with their vaccination program and they had low levels of vaccinated individuals? Think about it, logically. Are you seeing the same sort of pictures coming to India? What has changed? They've done a massive vaccination program within their country. It's just the stark reality of where we are. The only way that we're going to get back to a sense of normalcy, and I keep saying it, one person in the world who wants us to get back to normal in Barbados is Dr. Corey Ford. I say, you can put it on the front page of the newspaper. It's Dr. Corey Ford.
Thank you, Dr. Ford, but having spoken to most of these patients, however, that were vaccinated and some breakthrough infections did occur, have you received any information that gives you the idea that their actions would have changed post-vaccination? Did their habits change that would have put them in a position to be exposed or put them in a position where they would have risked becoming infected with the COVID-19 virus?
Before Dr. Ford answers Barry, sorry about that. Dr. Williams does have, I believe, another engagement. Would you like to say anything before you leave, Dr. Williams?
I'm just going to reiterate the message that I gave before, and we're listening to the engagement on vaccination. Although we look at vaccine rates, I'm hopeful that we continue looking at where the country also is at in terms of our capacity, in terms of our health care, our ability to speak to the overwhelming of our healthcare facilities, and also at not just at the deaths, but also at the other indices of how well we are doing in country. We've always said from the beginning that we have to look at a multiplicity of factors, and we continue to monitor them to see how well we are doing in country in order to determine whether we're going in the right direction at all times. So BAMP, of course, we are a little more conservative, and we will look at the healthcare factors, but we know that the government has to look at all the factors, not just health, but economic and financial and everything as well. But we are more conservative with respect to healthcare.
Thank you, Dr. Williams. Barry, would you care to repeat your question for the benefit of Dr. Ford, if you could?
Right, Dr. Ford, I was telling you, thanks for the information. I read how important vaccination drives are, but the information I wanted to gather from you was when you do speak to these patients who've had breakthrough infections, the ones that are vaccinated, based on information gathered from them as a health professional, have you been able to assume or to actually find out if their actions changed post-vaccination? Did they do things that put them at risk more? Did they do things that they would have not done in the pandemic before they were vaccinated? And could this have possibly led to the numbers of vaccinated people that we do see getting breakthrough infections? Thank you.
I think the question you've asked is certainly a good one. I have not really gotten that from most of the patients that I've certainly interacted with, but it's something that I believe from looking at the sort of international figures and international data that has happened in certain countries across the globe, including the US. There's good data coming from the US on that, and in Europe, for example, where people's practices and behaviors have changed, which has led to some of the challenges which people have seen. So that's all I can say on that at this particular point. Thanks.
Next question.
I just have one more question for Dr. Ford in relation to home isolation. I know we had heard from the health officials that they were getting some problems with people who were reluctant to leave their homes. Is that situation improved? People who were potentially getting ill or seriously ill, at risk of being seriously ill, I should say, sorry. You're having some problems in getting those people to leave home. Is that situation improved?
Yes, I'm going to pass this question over to CMO, but I will say one or two key points. You know, our aim is to try to save lives, and the longer that people take, and I'm going to repeat myself again, and I think the longer that people take to come into the system, I think every single person here has said that, the longer that people take to come into the system after they've tested, then it's a challenge. And I'm really glad you asked, because there are several cases, including a few that died recently, who decided that they were going to try to wait until at home and then call when they're really at the brink. And it's really heartbreaking. It's heart-wrenching. It's difficult for us as staff to have to try to deal with those sort of situations. But I understand that people may be fearful. And I always tell the staff, despite whatever decisions were made before, that we will put the best foot forward and do the best we can. But again, I say that on the backdrop of asking Barbadians to really, if you're ill and we're calling you in because we flagged you as a potential challenge, please come forward to let us try to help you the best we can. CMO.
So thank you. As with any new program, there were a few teething problems. As many Barbadians know, we introduced home isolation as a means to safely accommodate persons within their houses when they were asymptomatic. We have a system that we have put in place: red, yellow, and green. Individuals who have been assessed as green remain in their homes, and persons who are red obviously need more immediate type interventions. The issue is that there will always be a few persons who will not try to comply. And although we have had thousands of persons within home isolation, the overwhelming majority of those individuals have been compliant and remained in their homes. There have been one or two cases where you heard someone left the house and went into a supermarket, but we can count those on our fingers. So we have had the cooperation of the public. We get reports from Dr. Adana Grandison, and this situation is certainly under control. I think it was an excellent move. It gives Corey the benefit to certainly put more of his efforts on persons who are sick, and to give the healthcare team a bit of leeway and space to make sure that persons are safe. Thank you.
Dr. George, are there any further questions?
Yeah, just one more question, Lisa. Thank you for Dr. George. Dr. George, welcome back. Hope you had a restful holiday. The Prime Minister would have alluded to people in Barbados who would have contracted the COVID-19 virus eventually making the decision, a responsible decision, to be vaccinated. Does the Ministry of Health have any numbers in its database regarding that? Can you let Barbadians know how many people in your system did contract the disease, went through a 3-month process where they fully recovered and made the informed decision, having contracted COVID-19, then to become vaccinated?
I don't have that information at my fingertips. What I will tell you is that what we do is we let persons know that after you have COVID, you are to be vaccinated after that. It gives you further protection, because what we are aware is that natural immunity which you get from having a COVID infection is not as strong as vaccine-mediated immunity. And I think that is the take-home question, that all of us, regardless of our status, we need to be vaccinated. Certainly your immunity will assist you in the first 2 to 3 months after having a COVID infection, but we encourage persons that at least after a 3-month period, that you subject yourself to being vaccinated. The other issue is that in the short space of time I was off, there is yet another option for vaccination of the public. We have the J&J, the Johnson & Johnson vaccine. It has always been the Ministry of Health has always supported the position of having options for Barbadians, because we realize that people like a choice, and that the information regarding the vaccines are all over the internet, so they can make informed choices, but the vaccines are here. Thank you.
And check in once more to see if there are further questions. If there are no further questions from my colleagues, Prime Minister.
Thank you very much, Lisa. And I want to thank members of the media again. But I'd also like to say, and I should have said it before, that the representative of the Barbados Nurses Association is also here. And just before we close, Valerie, I don't know if you would like to say anything, Madam President.
Thank you, Madam Prime Minister. Good afternoon, everyone. And I want to say that the Barbados Nurses Association and that the government and the Minister of Health was very receptive of our interventions and took very receptive of our interventions. And we appreciate the opportunity to take the matter to our constituents. We're given the time to take the matter to our constituents before the safe zones are being implemented. And we continue to be in discussions, as all of us want a safer Barbados. So I want to urge all nurses that to stay focused as we all work towards having a safer Barbados. You're not disadvantaged in any way, and we will continue to have discussions as we prepare to work towards having a safer Barbados. Thank you.
Thank you very much. Ladies and gentlemen, I just want to thank everyone and to say to all Barbadians, we are at a point where, as I said, we are on a journey. And on a journey, we take stock, we recognize where we are, and we continue to commit ourselves to the way forward. The easing of time and allowing persons to get back to do more of the things that we're accustomed to doing in this country is a welcome addition now. We want to keep in this direction. But as a government, we know we can only keep there with the cooperation of as many Barbadians as possible, whether in vaccinations or whether in the testing or whether in literally adhering to the various protocols. Over the course of the next few weeks, it is going to require that cooperation. Later this week, members of the government and the senior public servants will be identifying and outlining what the activities in the run-up to the Independence and Republic celebrations will be. Similarly, we know Christmas comes thereafter. And similarly, from as early as tomorrow morning, we have the commemoration of the Remembrance Day, which has been once again changed in how we celebrate it, similar to last year, where we had similar concerns with COVID as we confronted this moment in time. I only ask, therefore, that we remember that we are all in this together. As we face this and multiple other things, we will continue to remain engaged, but I ask you simply, let us ensure that each of us plays our part. And if we do that, the progress that we have been seeing thus far will continue, and I have every confidence that we can put these moments behind us at the appropriate time. Thank you. God bless.
And thank you very much, Prime Minister, the Honourable Mia Amor Motley. Let me also thank the Minister of Health and Wellness, Lieutenant Colonel the Honourable Jeffrey Bostic, the Manager of Isolation Facilities, Dr. Corey Ford, the President of the Barbados Association of Medical Practitioners, Dr. Linda Williams, who had to leave us a little early. We were also joined by the Acting Attorney General, the Honourable Wilfred Abrams, the Chief Medical Officer, Dr. Kenneth George, and President of the Barbados Nurses Association, Ms. Valerie Francis Miller. Members of the media, thank you, and you for joining. Good evening.